Hello, hello. Wednesdays are actually becoming one of my favorite days of the week because I know that I get to come on and chat with you all about health writing and health content marketing. So happy Wednesday. I hope it's been a wonderful day for you. If you are new to this Wednesday live series, my name is Megan Freeland. I am the owner of Stock Rose Creative, which is a health content marketing organization. And I am a public health pharmacist turned health content strategist. And on Wednesdays, for the past couple of months, on Wednesdays, I've been hopping onto LinkedIn to talk about different topics related to health writing, specifically related to health professionals who are interested in transitioning into health writing, and really just sharing tips and insights that I've learned from my journey as a health professional who became a health communication specialist and a health content strategist. So as you may have noticed from today's title, we're going to be talking about 3 very specific reasons that I believe more health professionals should be health writers. And I'm going to launch us off with a story. It's one of the earliest memories I have of coming to the conclusion that there need to be more health communicators who have healthcare background. And I would love to hear your feedback, your thoughts about this particular story and kind of what intrinsically your response would be to a person who said this or to this thought process. So I don't remember exactly where I was. It was possibly LinkedIn or maybe a Reddit thread or, somewhere online, some type of social media site. And I came across a person who seemed to be from what I could tell, they seemed to be a writer, a freelance writer, who wrote for some type of health related industry. So maybe it was health. It was possibly a little bit of wellness, perhaps a little bit of medical, but they wrote in the intersection of those kind of 3 entities. So health, wellness, medical industries. And they were giving advice to someone who was asking about the qualifications, the credentials that you needed to be a writer in that particular industry. And that person's response was, this wasn't verbatim, but essentially what they were conveying was that you really don't need a health background or medical background or any health experience to be a health writer, which is not incorrect. But here is the part of that statement that struck a chord with me. They say you don't need to have a health or a medical background or any health experience at all to be a health writer or a medical writer. Just know how to Google stuff. And if we are giving that person the benefit of the doubt, right? Maybe that was meant to be just kind of maybe it wasn't meant to be as flippant as it sounded to me or as I perceived it when I read it. But I actually got a little bit upset when I read that statement because especially as a drug information trained pharmacist, my fellowship program in my area of specialty right out of my pharmacy program was in drug information and medical information. And so just Google stuff, that particular statement pierces my soul when it comes to health writing, medical writing, scientific writing, or any type of writing within that landscape. Because as you know, if you're a health professional, which most of you are who are tuning into this, the validity, the integrity of the sources that you use to look up stuff is vital. And it's not that you can't find high quality courses through Google. Like, you can use that as a tool, but in order to know that the sources you are ultimately finding and using through those Google searches, in order to know that those sources are credible and legitimate, there needs to be, it's not just Google stuff. It's not like a flippant thing like that. There's a lot of intentionality that has to go in that. And as a health professional, that's something that a lot of us are trained in, or at least are able to recognize what makes a source credible, what makes it valid, and then how do we interpret that information? So if it's a medical study, how do you interpret that data? How do you interpret the statistical analysis? How do you interpret the methods that they use to build the study credibility, and what does that mean for the content that you then write? So as we all know, health information can be very nuanced, especially if you are speaking to specific audiences, which I believe that with all health writing, you should be speaking to very specific audiences because that makes the information most relevant to whoever it is that you're speaking to. Nuance doesn't always come across through Google, right? So if you're just Googling stuff and you don't necessarily have that background to be able to assess and evaluate the types of sources that you are finding through that search, then that is going to affect the actual writing product that you create and the accuracy and the relevance and the credibility of the information that's being delivered to that end user, right? It negates the importance of health expertise in that information sharing process. And so that, like I said, that was kind of the first experience that made me think, wow, we really need to make sure that people who are involved in health writing and health content creation and health content marketing, it's important for those people to have training and have experience in the healthcare field. And so that's why you've been hearing me preaching for the past several months that more health professionals need to be health communicators, and specifically more health professionals need to be health writers. I know you may have been in a similar situation where like you were reading an article in a newspaper that was about a health topic. You know, COVID times, this has probably happened several times, but you read an article and you're like, I see the data that you're talking about in this article, but I am unsure how you came to this conclusion by the end of your article. Like this is not matching up. This is not making sense. Or you see a super misleading headline on an article that's being shared on Facebook and has gone viral. And then you read the article and it's like, well, the article is actually saying some good stuff, but this headline does not match. This headline is misleading. You know, this happens to me all the time. And I'm sure that you all can think of situations where it's happened to you. And if you have like specific situations in mind, definitely let me know in the comments, whether you're watching on live or in the replay. But I just wanted to share that story so that you could get a feel for why I believe that more of us with health backgrounds need to be in the health writing and health communication space. So this leads me into the 3 reasons that I think health professionals in particular can add value as writers for health companies. And it also works the other way around. There are also reasons that we are very valuable for health companies to have as health writers. So as I go through these 3 reasons, you're going to kind of see what I mean. So the first reason, right? Let's just be honest. The first reason is that direct patient care doesn't always cut it, right? There are several pharmacists, nurses, physicians, PAs, physical therapists, psychotherapists, you name it. There are many members of these health professions who we find ourselves in positions where maybe direct patient care was great at first, but based on where we are in our personal lives, it doesn't necessarily fit the mold, right? We need something that is a little bit more fulfilling or a little bit less demanding or a little bit less time consuming or a little bit more flexible, you know, insert whatever adjective you will there. But there are times in, you know, the life journey where direct patient care does not always fit in seamlessly. Or maybe you realize after working with patients directly or in direct patient care that you want to have a more holistic and a more broad impact on the public health landscape. That was my case. When I went into pharmacy, I knew from the jump that I did not want to work directly in patient care, but rather I wanted to impact public health from a larger scale. And so that's the reason why I went into health communications to begin with. I'm seeing some weird Wi-Fi stuff. So if I start getting shaky, let me know, and hopefully it'll fix itself in a few minutes. But that is what led me into public health to begin with, and specifically into writing, because I recognized that writing was a very helpful bridge to take what I knew as a pharmacist and connect it to what I could do in public health. Writing was that link between pharmacy and public health for me. So for you, writing may be that link between your nursing background and a public health, or between your medicine background and public health. Writing is a nice bridge to take your knowledge and your skills and your expertise and apply it to through a public health lens. And so that's reason number one why I think more health professionals should consider health writing as a career or as an addition, to whatever your direct patient care career may be. So the second reason is a little more practical, right? And the second reason also begins to tap into why health companies will find it valuable to have health writers who are also health professionals, who are licensed health professionals. And that reason is that Google and other search engines, but primarily talking about Google here, Google loves the credentials, right? Without going too in depth in this, search engine optimization is a key component of health content marketing. When health companies want to increase their reach and bring new people onto their site, to bring new people into their content, they use health content marketing in order to attract those new readers, those new website visitors. And a large part of the way that they do that is through search engine optimization. Search engine optimization, or SEO, is basically a strategy or a collection of strategies that you use to get your content to rank first, or between 1 through 10 search results on Google and in other search engines, but Google is the most popular. So I'm just going to talk about Google here. So when Google is determining what sites they are going to place on that first page, the algorithm is running through a list of factors to use to evaluate that website, because they want to make sure that when a person goes in and they type in a keyword or they type in a question or an inquiry, Google wants to make sure that the information they're providing them with is as valid as possible, especially when it comes to health information. That's something they've really been cracking on recently. And so they are really advanced at being able to crawl, which basically means to examine a website and identify different factors that indicate to them that this website is not only what it says it's about, but that it is a legitimate website. And so when it comes to health information, it is helpful for health companies to have on that website indicators of legitimacy. And one of those indicators is when that website can say, this person, Megan Freeland, Farm D, wrote this article. Or Megan Freeland, Farm D, edited this article, because Google recognizes that, an actual health professional was involved in the creation of this content. So if you look at popular health information sources, like if you think about Healthline, if you think about GoodRx, if you think about, I don't know about WebMD, but I would imagine WebMD. If you go to those articles that come up as sources of health information, you'll see that the people writing and editing those articles are often from the medical and health profession. That helps Google recognize those websites as legitimate sources of health information. So it is valuable for health companies to have health writers who are also licensed health professionals. Having that information on their website is a benefit for them. So that is reason number 2 why I believe that more health professionals should be health writers. I get this question all the time. I've been getting it a lot since I've started these weekly videos on Wednesdays. But people come to me and perhaps they don't realize that I'm a pharmacist, or maybe they're wondering if this is something that applies more broadly, but they're wondering, is health content marketing something that I as a pharmacist, or I as a PA, or I as a nurse can get into? And I'm like, yes, the fact that I am a pharmacist, it is what makes me so marketable to several health companies, because they realize the value in having someone who is creative enough and, well versed enough in content strategy and content creation to help them create this content, but also has the knowledge base and the experiential background to be able to like really do this accurately and in integrity. So that is reason number 2. And the last reason, which you have heard me say time and time again, but health professionals are well positioned to fight health misinformation online. This is like the core. This is the core, if you want to call it a core value of my company, Stock Rose, is to fight health misinformation online, or core mission is to fight health misinformation online. If you have a writer who writes for your company, and that writer, you, is a health professional or a healthcare provider or has that background, that is one of the strongest ways that you can counter the rampant and abundant health misinformation that is present online, especially right now during this dual pandemic of not only COVID-19, but also of disinformation in regards to COVID-19, the illness, the vaccines, etc. It is critical for us to start incorporating more people who have the qualifications to really counter those narratives that are being created. Another reason that I think we are well positioned to help fight that health misinformation online is that we have the experience of working with people directly, of talking to people directly about their healthcare. If you're a pharmacist, especially, a community pharmacist, you are talking to people all day. You are counseling people all day. If you are a nurse, you're communicating with patients and caregivers all day. We do this, like this is a part of our professions. And so the key here is that we have to figure out, if you don't have a health writing background, what you then have to figure out is, okay, how do I take the communication skills that I do have and translate that into written format? So, maybe there is a format transformation that has to happen there, but the fact that you have the experience and the ability to really communicate with people on a personal level makes us incredibly valuable when it comes to fighting health misinformation online. So that is the third reason that I feel health professionals are incredibly valuable as health writers. That brings me to, again, the mission of my company, Stock Rose Creative, which is fighting health misinformation online. And it became my mission, right, to turn that core belief into something that was more tangible, because this is something that I have been doing in my own professional career for years, but it's also something that other health professionals have been wanting to learn how to do and have been asking me for specific advice about how to do for a long time. And, if you are watching this and you have, we've talked via messages or we've had a phone conversation or something like that, chances are that if you ask me, hey, Megan, how did you figure out how to do this? How did you learn how to get into health writing, health content marketing for health companies? I probably told you that story, right? And then I probably sent you to a podcast, or I probably sent you to a video where I talked about it in more detail than I could give in like a 20 to 30 minute phone call. But then in a lot of cases, the follow-up question was, your story is wonderful. Your story is great, but I don't know how exactly to apply that to my situation. And I heard y'all, I definitely understood, that sentiment. And so I'm excited because I have finally, with the help of a lot of you, been able to put together a program that walks you through that process more directly and more specifically. So I'm introducing to you today the Health Professionals to Health Writers program, which is what I have been working on and almost teasing y'all with over the past couple of weeks. But I wanted you all to really understand what went into creating the program and why I created it before I began to talk to you about it. So the details about the program will come in next week's live video, Wednesday at 5:45 p.m. Eastern. But today I kind of wanted to focus more on the why behind it, and so that you can understand where it came from, right? So let's see what this comment is. Yay, thanks, Jane. Jane was an integral part of the creation of this program. So I really appreciate you, Jane, and all of the others who helped put this together. But so taking it back to when I started Stock Roads, right, my health content marketing company, I started that company in 2017. And as I grew in my health content marketing ability, and as the company grew, I realized that there was only so much content that I could create without, reaching capacity and maxing out on capacity. And there were several health companies that I wanted to work with and was excited to work with, but just literally didn't have the capacity to do so. And I was often in positions where I had to say, I would love to work with you in the future. Right now, I don't have the bandwidth to do so, but if this is something that's more urgent for you or more urgent need, let me know what it is that you're looking for, and I can put feelers out and see if there's, anyone that I can recommend. And in a lot of cases, I didn't necessarily have someone who I knew had a similar background and a similar level of experience that I could refer them to. A lot of them wanted someone who was exactly like me. They wanted someone who was a pharmacist or had a health background and who was also strong in content strategy and content marketing. And so I thought, okay, I want to be able to recommend other people for opportunities like these, specifically other health professionals for opportunities like these. But I don't necessarily have that network of people that I can do that for. So I think it would be helpful to build a program that helps people follow the path that I did, an improved version of the path that I followed, and helps health professionals learn how to become health writers who specialize in health content marketing, right? So I chose that option because running an agency is not ever something that was interesting to me. I would much rather teach people how to do this on their own so that they can have the same level of freedom and autonomy that I did when I was creating my business. But I realized that there were no programs that did what I wanted to teach people how to do. There were no programs that helped health professionals transition from their direct patient care careers or, whatever type of patient care career they had into health writing. Maybe there are programs that help you transition into medical writing with a more scientific lens, right? But to transition into health writing, health content marketing for innovative health companies, there was nothing out there that existed for that. And so I wanted to help fill that gap. There are a lot of business coaches out there, right? I worked with my own business coach when I was building my business. I still work with her to this day, and she's amazing. She's incredible. But the one caveat to that I have is that the health industry is unique and content marketing is unique. And while I love my business coach and still work with her and hope to continue to work with her into the future on other projects, I also wish that I had the mentorship and the guidance of someone who was more experienced in the health industry and in working with health companies on communications related initiatives, because that industry is so very specific and is very unlike any other. And so I thought it was important as someone who is in this position to be able to take my experience and my knowledge and be able to pass that on to other health professionals who are looking to make that transition as well. There was a lot of trial and error involved in my process of growing my business because I didn't necessarily have that insight into the business aspects of the health industry that I needed. And so having that lens now is something that I think is going to be helpful for the people who are going through the Health Professionals to Health Writers program in particular. So like I said, I'm going to give more detail next week, but just to give you kind of an overview of what the purpose of that program is, the overall program result, right, is to help health professionals like you learn how to fight health misinformation online and also build an additional stream of income through health writing, specifically through health content marketing. If I'm saying health content marketing and you don't know what that is, I would encourage you to scroll back to some of the previous videos that I've done over the past couple of months, because I go into detail about exactly what health content marketing is. But this program, a 12-week program with 5 different phases, is designed to walk you step by step, essentially through the process of becoming a freelance health writer for health companies. This program is only for health professionals. So if you are a pharmacist, a nurse, a physician, a PA, a physical therapist, a psychotherapist, a psychiatrist, if you are a health professional who has a licensed health professional who has completed a pre-professions program, you may have completed a residency, you may have completed a fellowship. That is not required, but I'm just trying to give you some parameters around who this particular program is for. That is who is going to benefit from this particular program the most. So next week is going to be essentially a Q&A about the Health Professionals to Health Writers program. So if there are specific questions that you have about the program, or comments that you have about anything that I've talked about earlier, like the 3 reasons that I think health professionals need to be more involved in health writing, I encourage you to drop them in the chat. You can also shoot them to me in a message if you'd rather that be a private conversation. That is fine as well. And if you have questions specifically about whether the program would be right for you, I welcome you to send me a message also. Darren says, thank you for promoting this career area. It gives me hope for my future as an aspiring medical writer. Yes, Darren, you should have all the hope in the world, because this is a space that is ripe with opportunities. So I'm glad that this is an avenue that you are thinking of, even as you are wrapping up your pharmacy school experience, and I'm excited to see where it takes you. So again, next week will be a Q&A. So if you have specific questions, drop them in the comments. If you have questions about your particular interest in health professionals to health writers, you can shoot me a message and we can chat in the DMs. Thank y'all for tuning in, and I will see you next week.